So home genetics tests are a great tool, and they are a great way to be able to kind of get a gauge of our familial history further back than like mom and dad and grandma and grandpa and even like siblings, and kind of paint a bigger picture, because we know now that so many conditions have a genetic predisposition, and diabetes is certainly one that it a genetically predisposed condition. And diabetes is like a multifactorial condition. It has, a genetics component and an environmental component. So a genetic predisposition does not mean that you will necessarily develop type 2 diabetes. And while with type 1, we do know a lot more about the genetics of it and the risk factors associated with it. So, for an example, with type 1, we know that the risk factors are inherited from both parents. In the case of type 1, someone who is also Caucasian is going to be more likely to develop type 1, especially with both parents having that predisposition. On the flip side, type 2, someone of African American heritage is more likely to develop type 2 along with the genetic risk factors. But the important thing is, being genetically predisposed does not necessarily mean that it's going to be your future. According to the American Diabetes Association, who gives us a lot of guidance on type 1 and type 2 diabetes both, you inherit a predisposition, but then something in the environment has to trigger it. So in the case of type 2, while there is that genetic side of things, does mom or dad have diabetes, grandma, grandpa, how far back does that lineage go? We also look at lifestyle factors, obesity, being overweight, being inactive, food choices. Those play a really big factor. So for type 1, a really popular example that we will give is something called twin theory, and it's where you have identical twins. Because identical twins will have identical genes, and when one twin has diabetes, the other twin is going to get that disease considered half of the time. Whereas when one twin has type 2 diabetes, that risk factor does go up to 3 and 4 of the time. So about 75% of the time, they're going to be predisposed to that disease. We know that type 2 shows a stronger link to family history than, say, type 1, but the environmental factors really do play a big role, and it's something you need to keep in mind when you're, worrying about what will happen, because there's a lot of choices that are things that you can prevent. They are lifestyle changes you can implement if you feel like maybe you're not necessarily making great choices all the time, which, no one does. With type 2, we know that it tends to run comorbid with obesity, and obesity also has a genetic predisposition. We know that obesity tends to run in families, and that, it's almost always a comorbidity with type 2. So it can make it a little bit harder to distinguish the risk association of that disorder. But studies have shown that a really healthy lifestyle and being physically active, making sure you get 30 minutes of physical activity at least 5 days a week, staying within a healthy calorie goal for your body weight, controlling sugar intake, that can all play a big role in preventing you from developing type 2 diabetes. And it can even prevent or delay yourself at the worst case scenario from developing it. And now we actually are seeing such amazing success with the obesity side of things, where there were groups of people that already had obesity and things of that sort, and they were overweight and they struggled to lose weight because of other genetic predispositions like PCOS and conditions like that. Now we have medications that are on the market that are FDA approved for weight loss, and they're actually in the class of diabetes meds called GLP-1, and they delay gastric emptying, and they have a lot of really positive effects on patients and can actually lower the obesity risk factor for type 2 diabetes, which in itself can have a big effect. So I wouldn't be worried just at point blank that you're definitely going to get diabetes just because you're genetically predisposed. Just keep in mind that the environmental risk factors play almost an equal role.